a 24-year-old woman presents to her gynecologist complaining of mild pelvic discomfort and frothy yellow discharge from her vagina for the past 2 weeks. She also complains of pain during sexual intercourse and sometimes after urination. Her past medical history is non-contributory. She takes oral contraceptives and multivitamins daily. She has had two male sexual partners in her lifetime and uses condoms inconsistently. Today, her vitals are normal. On pelvic exam, she has vulvovaginal erythema and a strawberry cervix that is tender to motion with minimal green-yellow malodorous discharge. A swab of the vaginal wall is analyzed for pH at the bedside. Vaginal pH is 5.8. Which of the following is the most likely diagnosis for this patient? So similarly, we go through the last few lines of the question and we will see on a pelvic examination, it showed vulvovaginal erythema. That means there was some inflammation and there is a strawberry cervix, which is a very particular finding for trichomonasis vaginalis. All right. Okay. And there's cervical motion tenderness, which is all right. And they have green, yellow malodorous discharge, which is also a very, very specific finding. Okay. And then when you see the vaginal pH, it is more than 4.5, which is the normal vaginal pH. It is 5.8. So that means all these things point out to Trichomonas vaginalis. All right. Not bacterial vaginosis. So we have thin white discharge, which is thin white foul smelling discharge, anything you can mention it as, which is found in bacterial vaginosis. Okay. And one more thing you have to remember in bacterial vaginosis, there is no inflammation of the cervix. All right. Whereas in trichomonas and candida, you will have inflammation. I'll try to write it down for you. Thick, white, curdy. All right. Or cotton cheese, whatever you want to say it in whichever language. So thick white discharge is present. One more thing you have to remember that in vulvovaginal candidiasis, there is normal pH of the vagina. It is more common in diabetics or immunocompromised states. All right. And the treatment is by azoles, like your azole drugs. All right. Then atrophic vaginitis is a completely different thing. It is basically dryness or something of the vagina, which is not very important over here. Okay. Coming to bacterial vaginosis, which most of the people got confused with. So you have to remember that for bacterial vaginosis, you will have firstly thin white discharge, as someone mentioned over here. Okay. And then you will have pH is more than 4.5. Okay, that means it does not happen on the normal pH. So pH is more than 4.5. Like in trichomoniasis, it's the same thing that they have pH more than 4.5. Okay, and then for bacterial vaginosis, there is no inflammatory findings. Okay, and whereas in trichomoniasis, there is inflammatory findings. That is why you have that strawberry cervix. Okay, inflammation of the cervix is there in trichomonas. That is why you have the strawberry cervix, right? Metronidazole is a drug of choice, and also we have clindamycin too. All right. But first line, if you ask me, it is metronidazole, and clindamycin can be used alternatively. All right. And drug of choice for trichomoniasis. And you have to remember one more thing, in trichomoniasis, you have to always treat the partner. Otherwise, there is high chance of recurrence.
Thanks for watching. Please give a thumbs up and subscribe for more.